Welcome to All Things Addiction. I am Fred Rottnek, Chief Medical Officer at ARCA and also Program Director of the Addiction Medicine Fellowship at SSM Health, St. Louis University School of Medicine. And today I wanted to talk to everyone a little bit about workforce development, how we recruit, train, and retain folks to do the work of the care team. And one of the reasons I think this is so important is that it doesn't matter how much money we throw at the issue of substance use and prevention and treatment if we don't have the professionals to do the work. So that's what really drives me at St. Louis U and SSM Health to start the Addiction Medicine Fellowship. We're currently in our 7th year. And a little background about addiction medicine. Addiction medicine was approved by the American Board of Medical Specialties in 2016 to have status as its own specialty, much like ENT or cardiology or GI. Addiction medicine now stands as its own specialty, and it is trained as a fellowship program. So once physicians complete their residency, they can apply for the 1-year program in addiction medicine. Now, what makes addiction medicine unusual in many ways as a field is that physicians can be board certified in any primary specialty. That can be family medicine, that can be pediatrics, OBGYN, general internal medicine, emergency medicine, anesthesia. Those specialties I just mentioned are the primary certifications of current and completed fellows in our program. So it's super cool that people can have a primary background in any given area in medicine and then do an additional year of training in the content and skills needed to do this work. Part of our program at SSM Health that is really unusual is we're one of the few programs that I'm aware of that has core rotations or months of training in inpatient consult service, maternal fetal medicine, or OBGYN, ambulatory care, and virtual care here at ARCA, and then also inpatient psychiatry. All of our fellows rotate through ARCA. Most of our fellows choose working here at ARCA as their continuity clinic, meaning that they have 1 day a week for the whole year where their focus is to not only see new patients in our Welcome Center, but also to manage patients repeatedly or with repeated appointments over the course of a year. In other words, like a primary care provider. There's advantages to both. At the Welcome Center, our fellows see patients under the guidance of one of our faculty members who are also ARCA employees. They'll see somebody brand new to treatment. They'll take in a pretty exhaustive history and physical. Also, it can be done virtually. But then part of the continuity clinic, though, is seeing repeat encounters so that the fellows really get to see how someone progresses in treatment and in care with the interprofessional team. Now, addiction medicine is just one aspect of the here at ARCA is a great example of an interprofessional practice. And by interprofessional, I mean 2 or more professions who work together in the care of a patient to achieve the treatment and safety outcomes of the team. They learn about, from, and with each other in the care of that patient. Other members of the team that we have here at ARCA include nurses, registered nurses, medical assistants, behavioral health specialists. That includes licensed clinical social workers, counselors, Missouri accredited counselors for addiction and substance use. We have case managers. We have our PAC team, which is the initial access for patients coming to our program who are in administrative roles. Of course, we have our executive team, but perhaps most importantly, we have certified peer specialists. Certified peer specialists, or CPSs, go by different names in different parts of the country. In some parts of the country, we refer to them as recovery coaches. We also refer to them as peer workers. Here in Missouri, we talk about certified peer specialists. And in one of our future conversations, we'll meet with some of our certified peer specialists here at ARCA.